Hi, I'm Abby, and I'm going to be teaching you how you can combat one of the deadliest and scariest conditions of our time, cancer. I will be presenting how yoga has increasingly beneficial effects on cancer patients mentally and physically. So, I'm first going to introduce cancer, one of the most known and devastating global health issues. Approximately 1 in 3 persons will be directly affected by cancer before the age of 75 years. So, you might have already experienced the effects of cancer within your family and friends. Many different variations of cancer, like breast, prostate, lung, brain, etc., and they all have long chronic side effects like fatigue, lesser quality of life, depression, and physical pain. There are existing interventions like counseling, social groups, or physical therapy, but they are not as well rounded. They are not as well rounded as yoga to help with both physical and mental barriers. Yoga has a variety of treatment styles and components, things we've talked about in class like pranayama breathing practices, asana stretches, meditation, and relaxation techniques. Yoga consists of exercises of body, mind, and spirit, which is the overall quality of life. Benefits have been studied under numerous conditions, including normal conditions, cardiac, addiction, depression, epilepsy, multiple sclerosis, and diabetes. Yoga is a good physical practice for cancer patients because they don't have as much energy to exude into normal physical activities. Yoga is slow pace, has modifications and props that could benefit their experience. Some of the physical benefits, which there are not as many physical as there are psychosocial benefits from this practice, but cancer patients do have an easier time with physical activity, less body pain and soreness, less fatigue, and more energy. Smaller effects like cardiac benefits, improved bowel habits, and combats physical issues that result from cancer treatments like chemotherapy and surgery. They'll have an easier time recovering and also battling the cancer. Some psychosocial benefits we're going to talk about here, but we have to talk about the barriers first that cancer patients experience. They have a lot of appearance insecurities because of their weight loss, hair loss, bruises, different accessories like tubes they have to wear to stay alive. They have low mood, anxiety within social interactions and crowds, and they have a fear of exercising or overdoing it and increasing health issues instead of bettering the health issues. Some of the psychosocial benefits are significant decrease in depression, mental fatigue, and distress, more positive mindset, increase in emotional and social ability, quality of life and relaxation increase, and smaller effects like less sleep disturbances, less caffeine use, improved appetite, and also less alcohol abuse. So, since yoga is becoming a more researched topic, especially in the cancer realm, it is becoming more announced within guidelines and recommendations within hospitals and actually put into the agenda. So here are some recommendations that they have listed. Nurses or instructors must be respectful but honest. So they must be honest with the patients whether they should do the yoga or if they're well enough and what limitations or implications they should do as well. Always listen to your body and consult about limitations with your instructor before class. Avoid poses that conflict with health issues like the ones listed here. If uncomfortable at any time, come out of the pose, rest, and discuss the incident with your instructor after class. Research your classes and instructors beforehand so you know what you're getting into, and educate patients on the practice to prevent injuries and so they know what props they would like to use and use them properly. So now I want to talk about how there needs to be a more awareness towards yoga for cancer patients. This is still a relatively new study, so there's not as much research or awareness even within the medical personnel about the benefits of yoga. So more awareness equals more research and more implementations within the medical services and increased quality of life for cancer patients. So I read a study that surveyed 40 healthcare providers before and after a 5-minute presentation on yoga benefits, and 90% of providers stated that they were more likely to recommend these services to patients in the future. So this really shows the significant effects that awareness can have and how quickly it can spread as well. Potential significant benefits from other forms of yoga that haven't even been studied or put on trial yet, like Kundalini therapies. These therapies that I read about consist of specific meditations and practices for each side effect and symptom for cancer, and even specific types of cancer. These practices were used on OCD patients and significantly and immediately benefited them in a trial. So you could see how these could do the same benefits for cancer patients as well. So spreading your awareness and education to others affected by cancer so more people in need can take advantage of these benefits and the research in the future so that these can be implemented into more services as well. So you could change lives by talking about this to your family members that have experienced cancer, or suggesting it to them to ask their doctor, and more. And here's my references. Thank you.